visual
नमस्कार सबैजनालाई आज यस नेपाल सेयर सोसाइटीले आयोजना गरेको हेल्थ वर्कसपमा जुम मार्फत उपस्थित हुनुभएका सम्पूर्ण सियाटलमा रहनुभएका नेपाली कम्युनिटीका साथीहरू र बाहिरबाट जोइन गर्नुभएको सबैजनालाई हार्दिक स्वागत गर्न चाहन्छौँ हामी। आज हामीसँग हुनुहुन्छ डाक्टर सुदिक्षा बास्कोटा। उहाँ चाहिँ नेचुरोप्याथिक फिजिसियन हुनुहुन्छ र उहाँ हाम्रै सियाटल एरियामै प्राइमेरी केयर फिजिसियनको रूपमा काम गरिरहनु भएको छ। उहाँ एबन्डेन्ट इन्टिग्रेटिभ मेडिसिनको फाउन्डर पनि हुनुहुन्छ र उहाँले यस हामीलाई सियाटल नेपाल सियाटल सोसाइटीलाई चाहिँ अब हाम्रो यस पेन्डेमिकको टाइममा सबैजनालाई हेल्थ सम्बन्धी कन्सर्नहरू भइरहेको टाइममा चाहिँ हेल्थ वर्कसपहरू गरेर हामीलाई भोलन्टियर रूपमा सहयोग गरिदिनु भएको छ। त्यसको लागि हामी एकदमै आभार व्यक्त गर्न चाहन्छौँ उहाँप्रति। यस टाइममा हामी सबैजना नै हेल्थ सम्बन्धी एकदमै कन्सर्न छौँ, लाइक कसरी हेल्थ राम्रो पार्ने, अझ मेन्टल हेल्थको एकदमै आज आवश्यकता रहेको यस टाइममा उहाँ त्यसमै स्पेसिफाइड गर्नुभएको र अरू हेल्थ सम्बन्धी क्वेसनहरू पनि हजुरहरूले राख्न सक्नुहुन्छ। हामीले इमेलमा पठाए अनुसार यस वर्कसपमा चाहिँ हामीसँग लाइक मेनली 6 भागमा हामीले डिभाइड गरेका छौँ। सुरुमा उहाँको इन्ट्रोडक्सनबाट हामीले सुरु गर्छौँ। त्यसपछि उहाँले मेन्टल हेल्थबारे आफ्नो कुरा राख्नुहुन्छ। त्यसपछि अल ट्रिटमेन्ट सम्बन्धी ब्रिफ इन्ट्रो, त्यसपछि चाहिँ रिसोर्सेसहरूको बारेमा नि उहाँले कुराहरू गर्नुहुन्छ र लास्टली अब हजुरहरूसँग केही क्वेसनहरू रहन्छ भनेदेखि यही कल मार्फत हजुरहरूले सोध्नु पनि सक्नुहुन्छ र केही अब पर्सनल आफ्टर दिस कल पछि पनि उहाँसँग कन्ट्याक्टहरू गर्नु पर्यो भनेदेखि उहाँले कन्ट्याक्ट नम्बर पनि सेयर गर्नुहुन्छ। हामीले लिङ्कहरू हाम्रो इमेलमा राखि नै सकेका छौँ र पर्सनली हजुरले केही क्वेसन छ भने आजै राख्न पनि सक्नुहुन्छ र पछि उहाँसँग पर्सनली इमेलहरू मार्फत फोनहरू मार्फत भेटेर पनि कुराहरू गर्न सक्नुहुन्छ। अब म सुदीक्षाजीलाई वेलकम गर्न चाहन्छु। थ्याङ्क यू एन्ड भेरी मच वेलकम डाक्टर सुदीक्षा बास्कोटा ज्यू। हजुरले अब सुरु गर्नुहोस्।
Surajji, thank you so much for organizing this event. म नेपाली र इङ्ग्लिस दुईटै ट्राई गर्छु, तर just you let me know कुनै कुरामा translation चाहियो भने just let me know. But mostly I've prepared my PowerPoint in English, but I'm happy to go back and forth. So just let me know. So I'm just gonna get right into it. So as a agenda, a little bit of myself. Surajji le ramroसँग मेरो bio भन्नुभयो, तर पनि I'm gonna highlight few things. Just introduction to naturopathic medicine or physicians in state of Washington. Overview of mental health in South Asian community is on my agenda for third time on this symptoms of depression, the causes of depression. And the primary focus say my lifestyle and nutrition ma banako chu, but I will also talk about other medications and things like that, and similar format for anxiety, and then lastly contact information for myself if you want to get in touch with me. So I graduated from Bastyr University, and then I did a residency at the teaching clinic of Bastyr University again, and then I'm an adjunct faculty there right now, and I see a lot of patients through my students. I supervise students there at Bastyr University. And also I see patients at West Seattle High School, and I also have my private practice at Snohomish. So I'm kind of all over the place, but I've kind of made a contact information easy for you to look at the end of the slide. So if you want to contact me in any of these places, except West Seattle High School is only for high school students. So I primarily see adult primary care. Oh, sorry about that. I'm gonna go back. So I primarily see adult primary care, and I have really special interest in diabetes, cardiovascular wellness, women's health, and mental health. And then my philosophy, I really like whole person care. I think it's really important to look at a lot of different aspects of one's health. And so I really enjoy that, just sitting down with patient and just making sure that they know all the information in order to make their health decision. I talk about benefits and risk and all the aspects of medication or any treatment plan so that they can decide what they want to do, how they want to go about. So I shared decision making is really important to me in my patient care, and I really believe in team approach. I'm just part of your healthcare team. I really guide you through your treatment plan. So I really believe in whole person care. So you'll see that throughout my slide. I've put in some my philosophy is going to come throughout the PowerPoint slide that I prepped for you today. I really want this to be interactive. So if you have any questions, just let me know, and just you can feel free to unmute yourself and just ask away, or just put it in the chat and we can talk about it. I'll try to go back and forth with my chat, but also please, I really want to know, answer your questions, and so please let me know what you want to know about or learn more about. Okay, so disclaimer. So I really don't have any financial disclosure. Other than that, I'm also the owner for my practice, Abundant Integrative Medicine, and also I want to make a disclaimer that this is not a medical advice. And if you really have any questions related to your physical or mental health, I really highly recommend that you reach out to your provider. And if you don't have one currently, then make sure to find one. So yeah, so I just wanted to get that out here. Okay, so I'm just gonna, this is some of the things that I get, I clarify for my patients. Most of the time, there's a little bit of confusion with the ND, MD, DO. There's so many acronyms, so I kind of want to clarify some of the common questions that I get. So in the state of Washington, NDs are primary care providers, just like MDs, DOs, nurse practitioner, and PAs. However, NDs have rigorous training on nutrition and lifestyle medicine, in addition to pharmaceuticals, botanical medicine, physical medicine, which is kind of like your chiropractic manipulation, and also counseling and minor surgery. There are some limitations to going to ND as your primary care. It is not a big limitation. However, opioid prescriptions and your controlled substances we're not able, it's out of our practice. So except the testosterone, which is also a controlled substance, but we're able to prescribe that with DAL license. So there's some restriction, but I don't see that as a big one. So NDs are very well suited for your primary care because they really talk about whole person care, and I really believe in that. Okay, so I think you've probably heard, everywhere in the news and everywhere that pandemic and mental health is coming up a lot. I think we are faced with new realities of working from home, and some people have lost their jobs, and trying to homeschool your children, lack of physical contact with their family and friends. You're not able to see them as often as we used to be able to. So I think some of it is actually really normal to have those experiences of fear, confusion, or stress, because it is new to us. It's kind of traumatic to be in pandemic. So it is new, it is normal. At the same time, this might be also a trigger for your new onset of depression or anxiety of any other mental health, but also so it's really important that you get assessed by a healthcare provider if you are worried about, oh, this might be a new stress, I'm not able to cope with it. It's really important that you get care. Also, individuals who are already experiencing mental health disorders are having new challenges because there may be lack of access, because there's a lot of loss of employment, or just maybe they may not have privacy at home to do telemedicine. So I think there's a lot of challenges faced by mental health, all people who already had mental health. So it's also important that you go back to your provider and try to figure out your next steps. Okay, I'm just gonna keep going here, but just let me know if you have any questions. Okay, this is, I think, a really important slide. I think I kind of want to go back pre-pandemic. I think mental health in South Asian community was already an issue. I think even before pandemic, in South Asian community, mental health disorders were already underdiagnosed and treated, which was the reality for us. And Nepali community is part of South Asian community. So a lot of the data and evidence that I'm going to talk about today is going to be on South Asian population in the United States, because that's the closest thing we can get to as a population. It's really hard to do a study or medical literature that is really focused on just Nepali community, because that's a really small population. But the closest thing I can get to is South Asian community, or the studies that are done on them. So I'm going to extrapolate a little bit from that studies, because they're also pretty relevant. We're pretty geographically, we're pretty similar. We have similar belief system, cultural values. So I'm going to take some of the baseline from there. So as you can see, the slide is pretty disturbing, but this is the reality. The silence about mental health in South Asian culture is pretty dangerous, and it has been that way for a really long time. We're not able to talk about mental illness in our culture. It's a taboo. It's a stigma. There's a lot of stigma and discrimination attached to that, and we see that similar trend in Nepal actually. So the third article that I posted over here, we see similar trend in Nepal and India and a lot of the South Asian countries. And I think that, and then we bring that values and belief system with us when we immigrant to a different country, and we're kind of building community based on those values. So it's kind of obvious that we see that similar trend even in the United States. So my talk is based on mostly on, this is the kind of background or the baseline for having my talk over here. My next slide, I just want to show that, a lot of celebrities are kind of going out there and in public to raise awareness about mental health. Deepika, I think, came out a few years ago saying that she had depression and she battled with it for a real long time. So I think this was kind of, brought a little bit of awareness in people of saying like, okay, maybe, it is an issue and we need to talk about it more. So I think that was nice for her to use her fame to, bring awareness to mental health. So I'm going to, dive a little bit deeper into why those perceptions are, or maybe what are some of the common perception of mental health in our community. We look at mental health as a little bit of sign of weakness. We see that as, oh, this person who's not able to control their emotions or anything like that, as a sign of weakness, and they're not strong enough to deal with that. So we kind of see that way for our people who are going through mental health disorders. Other second one I'm here, I've put in is all in your head, which is kind of invalidation of our patients who are going through mental health. It's like, oh, it's all in your head. You're not able to, it's invalidating their experiences of having those mental health disorders. Stigma and taboo, which kind of I talked about as a general theme. Family reputation and expectations in society. I think that's a big one. I think as a culture, we really have we put a lot of values in our family and reputation, and we really believe or think about what other people are going to think about us. So I think that is really going back to that stigma and taboo that's really connected to our family expectation. We want to make sure that our family expectation and reputation is really good in this society, and somehow mental health is tied into that, being not a great thing to be attached with. Religious belief came up a lot in my search in terms of, I kind of deserve this as my karma, because it's kind of like normal that I'm experiencing this because it's part of me, and it's really, I deserve this, came up a lot. This was very interesting. The other next one topic that I'm going to talk about is fear of being on medication or talk therapy. A lot of people were actually, not seeking mental health care because they kind of knew what treatment or options were out there, and those were medications or talk therapy, and they kind of had a fear about that. They didn't want to be on medications. And similarly, essays with South Asian were actually unlikely to get care if the Western diagnosis were used. So, this was a study that came out from Britain, and it was particularly in immigrant women that what they saw was they were actually would not like to get care if certain diagnoses were associated with like depression, anxiety, but if they were talked about tension, stress, then they were able to talk about their mental health much more and were likely to get the healthcare. This last point was really interesting as well, that if explain that mental health can actually affect their physical health, we were actually much more likely to get treated. So, for example, if mental health, if a provider took some time and actually explained that mental health was going to affect their physical health, such as their heart disease, reducing life expectancy, then we were much more likely to get treated because we were much more open to that treatment. It was physical health was much more important to us than mental health. So that was really interesting as well. I'm going to go to my next slide over here. I kind of talked about the barriers in our own culture why we're not able to receive mental health care, but also at the same time, we also have barrier in healthcare. Oh, sorry about that. Barrier in our healthcare system in US. I think the history of US has a lot of racism in it, and then our healthcare system is not immune from that. So we have a lot of patients, they're not comfortable sharing their mental health issues because of that. They might have experienced some discrimination at doctor's office. For example, I have some patients who have multiple times they've told me that they left their primary care doctor because they were kind of shamed at like eating a little bit of more rice, even though they had diabetes, So I think there's a lot of a little bit of discrimination that can happen, or our implicit bias can come into our patient care, which can really affect the care that our patients get. Language barrier, I think, is a huge issue. English is our second language, and then the other thing that it's really interesting is that some of the things that we want to translate from our Nepali or Hindi or whatever or language we have, there aren't even translations in English that we can actually use at our doctor's office. So we kind of don't have those words or vocabulary that we can translate, especially relating to mental health. So that is a big barrier to explaining what's happening to you at doctor's office. And then I think a lot of things gets lost in that translation. As you can imagine, lack of health insurance is due to visa status is a big issue because some of the let's say Apple Care in Washington State is actually not covered if you're not if you don't have a green card or citizenship. So this is a really big barrier to getting a health care. Discomfort, I think I kind of talked about that, discomfort with doctors in general, to mention mental health issues, and also we don't have enough culturally competent providers in this field to really understand and provide that kind of care. So I'm going to dive into some of the mental health disorders. I just want you to be aware that there are a lot of mental health disorders, and some of the mental disorders that are most common and gets attention are depression and anxiety. So even within depression, there are multiple types. They're recurrent and so on. Even with anxiety disorders, there are lots of generalized. There are lots of phobias. You may have heard people not able to get to plane or water, or not able to get out of the house because they're fear of being in closed spaces or people. So those all follow under anxiety disorder. And we also have other mental health disorders such as bipolar, schizophrenia, psychosis. Substance abuse disorder is a big one. Addictions, I think there's a lot of addictions. Some of the ones that are getting attention these days, or even they're having a hard time even distinguishing whether that's addiction or not, is internet addiction, tech addiction, gaming. So that's really interesting things coming up. ADHD and eating disorders are also prevalent. So mostly I'm going to focus today on depression and anxiety. So I'm going to go to my next slide. So depression is feeling of sadness, hopelessness, loss of interest that interferes with your self-esteem, sleep, appetite, your jobs, your family relationship can be affected. Your daily activities can be affected. There's some, I know I have some patients who are depressed that they're not able to cook for themselves, care for themselves. So that's also part of the depression piece. And thoughts of self-harm may be present, may not always be present, but also should be assessed at every visit. So I'm going to talk a little bit more into the symptoms of depression. So I think I kind of already touched on the loss of interest, pleasure in things, the things that you used to really enjoy and bring joy to you. They don't really, you're not able to do them, or you just they don't bring you pleasure anymore. You don't want to do them anymore. It's one of the symptoms of depression. Insomnia, which meaning that you're actually not able to sleep, fall asleep, or stay asleep, is also part of the depression symptom. Sleeping too much, you can actually just sleep a lot in the morning or towards the daytime because you don't feel the motivation to get up and do things, so you're just sleeping a lot. Hopelessness, which I talked about, lack of motivation, self-guilt. You can have lots of memories from the past or whatever you did, and you can feel guilty and ashamed of yourself. Change in appetite is also a big one. You can either have loss of appetite or you can just get hungry all the time, which kind of correlates with maybe with your weight gain or weight loss. It can be either. Thoughts of self-harm, as I talked about earlier. Irritability, I think irritability kind of, is very common, but at the same time, it can be a symptom of depression. Lack of concentration, mood swings, excessive crying, and fatigue are some of these depressive symptoms. Okay, so I kind of want to talk a little bit more about a myth about depression that we have. I think the common one that gets interchangeably used is sadness. Sadness is not same as depression. Depression is more complex than that, and people who are experiencing transient sadness may not have depression. So sadness is a very common human expression. So you can be sad because you might have lost a job, maybe there's a breakup of your romantic partner, or there may be so many things that may bring you sadness, but that transient sadness is not depression, and I think that gets confused a lot. So you want to make sure that it's not confusing. Also, another myth is, I hear this a lot, is people who look happy and exhibit laughter doesn't mean that they may not have depression. There are people who, are very happy. They can, laugh a lot in office, but when talked about their depressive symptoms, they're depressed and have suicidal ideations. So that's also a myth about depression. Also, depression has certain criteria which has to be analyzed by your healthcare practitioner. So I would highly recommend you don't self-diagnose. So just the fact that the depression and sadness is pretty different things. Some of the causes of depression is pretty intuitive. I think you can understand the psychological trauma, death of loved ones, isolation. I kind of also want to expand your psychological trauma as immigration is a big psychological trauma that you're kind of moving from one completely different culture to different culture. So culture shock might be a trauma for you, and that can trigger depression. Facing discrimination, facing any kind of discrimination based on your color or things like that, then that is also a trauma that can trigger depression. Abuse and neglect, if you have any trauma in the past or currently, that can definitely cause depression. Situational, it could be also transient, situational that can trigger depression. For example, economic hardships, unfulfilled relationship, burnout, job dissatisfaction, deportation. I think we can imagine that visa status can also cause a lot of the depressive symptoms. And then also, I want you to know that there may not be any reason for to be depressed, and you might have depression. So it's that's also there. Okay. So other causes for depressed mood. So other physiological, so this is really important because I think you may think like, oh, I have depressions, I don't want to go to a doctor because they might put me on medication, label me with depression, all that. But sometimes you might feel depressed because of the physiologic reasons. So it's really important that you get care, because anemia, which is your low iron, a lot of the females experience, it's very common for females to experience this because they're bleeding every month. So anemia is a big cause for feeling depressed mood. Also vitamin deficiencies in nutritional status. I'm going to talk about this a lot more in my next slides, so I'm going to skip this one for now. Also thyroid disorder. If you have issues with your thyroid, then you may feel depressed mood. Diabetes, that blood sugar fluctuations can also cause changes in your mood. Insomnia, I think we all know insomnia is not you're not able to fall asleep or stay asleep. I think sleep is a big one for our cognition, our memory and mood. So if you're not able to have better sleep, restful sleep, then you may feel that depressed mood. I think alcohol and drug use is pretty obvious, and you can kind of think about that. Chronic kidney disease, I think if you have a kidney disease, you're not able to filter out a lot of the things in your body, and then that things can are pretty neurotoxic, so that can damages your nerves, and that may lead to some of the depressed mood that you can think of. Cancer is a big one because it's life-changing for people. It's a lot of uncertainty. There's a lot of things that happen in cancer psychologically, so that can make you feel depressed. And I think COVID and other diseases, or just having chronic disease, can make you feel there are risk factors for feeling depressed. I'm going to jump into anxiety disorder. So I think this is one of my professors described it the way they described it to me in terms of depression, anxiety. When I first learned about it, is depression is something, maybe more of the past. You're thinking about the past experiences and you're feeling guilty and then shame. But maybe anxiety disorder is kind of you're worrying and fear about the future. It's more, it may not be true for always, but also that's how that's how I would try to differentiate that. So persistent, uncontrollable, and overwhelming fear or worry. If it gets excessive, it can affect your, it can be disabling, and it can affect your daily activities of living, your relationship, your family and job, and so on. So again, that's your anxiety. You may have anxiety disorder, and I'm going to differentiate a few things in my few slides coming up. But again, there are multiple types of anxiety disorders. I'm going to be focusing mostly on generalized anxiety disorder, but there are also panic disorder, social anxiety disorder, phobias, separation anxiety, post-traumatic stress disorder. A lot of our war veterans experience that. People coming back from wars have those have PTSD, obsessive compulsive disorders, and things like that. In my next slide, I'm going to talk a little bit about, I think, this is again, it's good to differentiate between everyday stress versus anxiety disorder. An anxiety disorder is real medical condition, just like your physical condition, such as heart disease. So it is different than everyday stress. So worrying about paying bills, landing a job, breakup, or important life events it's probably your everyday anxiety. But constant worry that causes significant distress and interferes with your daily life, that may be your anxiety disorder. Embarrassment of yourself, feeling embarrassed sometimes, or just being in an uncomfortable, awkward social situation is everyday anxiety or everyday stress. But also avoiding completely that situation because your fear of being judged or embarrassed or humiliated, that may be anxiety disorder. So this is a kind of like a really nice slide that I thought I would go into, just differentiating between everyday stress and anxiety versus anxiety disorder. And the other thing that we just know is it can run in the family. It can be genetic. So that is also important to know. Again, going back to common signs and symptoms of anxiety, so feeling nervous, restless, tense, having sense of impending doom or danger or panic. It can, it can be also panic attack. Having increased heart rate, or breathing rapidly, sweating, trembling, those all can be some signs of anxiety. Feeling weak or tired because you're kind of going, your heart is racing, your breathing is rapid, and then you suddenly maybe crash, and then you feel weak and tired. Trouble concentrating because you're thinking about so many things, or it's overwhelming, you're not able to focus on one thing. Have trouble sleeping, same thing, your just mind is racing and you're not able to fall asleep. Experiencing gastrointestinal problems, I think this is a really interesting one and a big one. I think that it's like whether it's a chicken or the egg kind of thing, in terms of, did you have gastrointestinal disorder problems, and then that led to anxiety, or you had anxiety and then you had the GI issues. It's kind of intertwined with each other, so this is really important. When we see a lot of GI problems with the anxiety and vice versa. Having difficulty controlling your worry. I think that's kind of the definition of the anxiety. And fatigue. I don't know if I put that in here, but the fatigue is also one of the symptoms. So I think, again, I think same thing with depression that I talked about. There are physiological causes of anxiety. So it's really important to not assume that you might just have mental health, mental illness of anxiety, but you can have anxiety just because of some of the physiological reasons. For example, thyroid disorders. I think I talked about thyroid being also cause for depression, but also if you have hyper or the more thyroid, then the thyroid disorders can cause anxiety. Heart disease, you might just have some flutter or AFib, but there are all these other heart conditions that can lead to anxiety. So it's really important that you get care. Asthma, I think asthma is a big one. There's, if you're not able to breathe very well, that can be diagnosed as anxiety, but also not being able to breathe very well can also be symptom of asthma. So it's important that you get treated for asthma. Blood sugar issues, I think I talked about that already, but I'm going to bring it up again because even having higher blood sugar or low blood sugar, both of the symptoms are exactly the same. You're feeling that trembling, that sweating feeling. You get that with the blood sugar issues, so you want to make sure that you're not anxious or you're feeling that anxiety because of blood sugar fluctuations. Electrolytes imbalance, our kidneys tightly regulate our electrolytes, but if that goes out of balance, you'll feel the symptoms of those shakiness and fluttering of your heart kind of thing. So it's not good to assume that you might have anxiety. Drug use and withdrawal, I think that's pretty obvious. Irritable bowel syndrome, I think we kind of talked about that GI problems that I was talking about. It's intertwined with anxiety a lot. Chronic pain is, people who are dealing with chronic pain, everyday pain, back pain, or a lot of other pain, they can have, over time, they can develop anxiety because they're in pain so much and they're having to deal with that pain every day. So it's really important that your pain gets managed. Also, excessive use of caffeine. Just the caffeine has that effect in our body that causes a lot of the things to produce in our body that makes you feel this anxiousness, or just feels like sweating and things like that. So you want to make sure that you're not drinking caffeine throughout the day or anything like that. You want to stop at some point, or just limit to one cup a day, or two cups of coffee a day. Tumors also can cause anxiety, so which is not the common one, but also I just wanted to make you aware of that. Okay, I'm going to go on to my next slide. I think it's really important to understand why these mental health disorders need to be treated and given lots of importance equally as our physical health, because untreated depression and anxiety can lead to poor quality of life, We can have heart disease. Hypertension is a big one because you're not able to sleep. You can have hypertension, elevated blood pressure. Social isolation, you're not able to connect with people, and that leads to social isolation. Chronic pain, I think I talked about chronic pain leading to anxiety, but also complication of anxiety and depression is eventually you'll start to feel pain in your body. Self-medication, you may not be even aware of that, but you may start to self-medicate through drug and alcohol use. Trouble sleeping, I think we kind of talked about that a lot already. Affects your career, school, relationship. Eventually, you are also likely to have reduced life expectancy, and some people commit suicide with these medical conditions. So this, I'm going to talk a little bit more about the signs and symptoms for depression, anxiety, and kind of, so this is very interesting concept that, maybe we don't know why that happens, but there's some symptoms, or we don't, in the South Asian culture or the patients, we may be also missing those diagnoses because they may present a little bit differently than compared to other populations, such as white Caucasian population. So what the medical literature have found is actually a lot of the symptoms are appearing in your body versus the it may be, again, some of the barriers that I described today, it may be because of that, or we just present a little bit differently in terms of the depression and anxiety. So a lot of the symptoms that are common to South Asian are fatigue and tired, or just feeling of unwell. That tiredness in the body, this may be part of your depression symptoms or anxiety picture. Change in appetite, mostly I think change in appetite is a symptom for overall population. However, loss of appetite was seen more in the South Asian population. Missing family and friends from country of origin, I think that's also normal, but also at the same time that could be a sign of your depression and anxiety symptoms. Crying, feeling sad and lonely, isolation. Lots of aches and pains in the body is very common for this culture to also have mental health present in headaches, pain in the body, wanting to escape or run away. Maybe that's also tied to missing family and friends from the country of origin. So that is probably also tied together. Heaviness or chest pain. Sexual dysfunction was a big one for this patient population to show up as just a symptom of depression and anxiety. Also, loss of hair and white hair are also some of the symptoms. Okay, I'm going to keep moving along here. So I think I kind of talked about suicidal ideation. Suicidal ideation, very common. Even people with the mental health disorder can experience this, but it's more prevalent with mental health disorder, and treating underlying health condition is really important. I think so, whenever we think about suicidal ideation, prevention, we think about suicide hotlines and things like that. I think it's really helpful that hotline is really helpful when people are in crisis. However, we should understand that suicide prevention is actually much more and bigger than that. It's about affordable housing. It's about policies that we have in our, where we're living. It's about affordable healthcare, stable housing situation, community. This is a really good post that I found in social media a few days ago and decided to use it. Also increasing accessibility to mental health care, and also destigmatizing mental health care and accepting people who identify LGBT community. So it's really important. So suicide prevention, I think it's really helpful to have that hotline, but also it's deeper than that, and it's much more bigger. Okay, so we're getting into treatments here now. So treatments for both anxiety disorders, really, I think treating the cause. Maybe sometimes we may not be able to find the cause, but trying to treat the cause is really important. So medication, there's lots of medications out there that can be really helpful and have a lot of lot of studies on them and safety studies on them, so they can be on board. So there's a lot of medication options. Also, I think a lot of the, there may be confusion in our population that there may be only one form of counseling and they're not interested in that. However, there are lots of various types of counseling therapy like CBT, cognitive behavioral therapy, ACT therapy, which is based more on mindfulness. So there are a lot of options, and if you don't like the ones that your provider is providing you, then find something that you may be interested in. Botanical medicine, I prefer. I attract a lot of patients who don't want to be on medication, so I do use a little bit of botanical medicine as well in my patient care. Other mind-body therapies like meditation, biofeedback, craniosacral therapy, acupuncture can be brought on if you're interested in that. Also, I kind of want to bring that, South Asian people were not they were not able to participate in mental health care if the literature saw that people were not able to participate or didn't want to participate if the treatment ideas were not holistic. So I think this is also a great way to kind of put together a treatment plan that is really individual to that patient. And also, I think in the anxiety section, that some of the risk factor for having anxiety is actually buildup of stress. So we need to have, even for prevention perspective, having some of the mind-body therapies on board even before you have anxiety can be really helpful to prevention, and lifestyle and nutrition, and correcting vitamin and mineral deficiencies, which I have some slides on soon. So I think, I kind of talked about this earlier, but treat the whole person, and really knowing why they're feeling depressed or really trying to understand what's missing is really important. And some of the things, the community is a big one for people. And some people may be with families and friends, but still may not feel that community. So it's really important they have community. Movement, I think finding things that you really like, how you want to move your body is really important. Access to clean water, nourishing food, meaningful work. Job dissatisfaction is a big risk factor for having these symptoms. So having some kind of meaningful work is really important. Restful sleep is which I talked about a little bit earlier. Connection to nature, spirituality can also be part of the treating the whole person part. So I kind of want to touch on the foundation of health because I think this is really important for prevention as well as the treatment part. So foundations of health, what we say in our naturopathic medicine is basically we need to build health in foundations. And then there are certain foundations we need to have in order to have health. And I'm going to talk through some of those foundations. And one of the biggest foundation is nutrition. So what I talked about earlier, some of the blood sugar fluctuations and things like that can cause change in mood. So in order to alleviate that, regular meals to avoid blood sugar fluctuation is really important if you're having the symptoms. Or adequate complex carbs, protein, healthy fats, fruits and vegetables in your regular meal is really, really important. I think protein are the amino acid which are going to are building blocks to the dopamine or serotonin, which make you feel really good in your body. So it's important that you have adequate protein in your diet. Really important. Also, complex carbs, you probably don't hate your carbs. They're really important. Especially complex whole grains are really important because they have lots of B vitamins and things like that are going to be helpful for your brain health. So really, really important. Also, I think I talked about a link between your digestive health and mental health. We're seeing lots of new studies on this. About our 90% of our serotonin, that hormone that makes you feel really good in your body and mind, is actually produced by your in your digestive system, by your microbiome, which is your gut bacteria. So it's really important you have a really good digestive health to support your mental health. And also, I think I already touched on this, but really having those antioxidants, your vitamins and minerals are part of your pathways to make those neurotransmitters. So it's really important that you have that in your food. Okay, these are kind of my overall overview of the nutrition part. So I'm going to move into next. It's in terms of sleep. It's really important that you have 7 to 8 hours of restful sleep. That helps with your mood, memory, cognition. If you're having, insomnia, not able to sleep or falling, even with the 8 or 10 hours of sleep, you're not able to feel rested, then I would highly recommend that you get some kind of care, because it's really important to have good sleep. And also, some people have sleep apnea, that they're not able to breathe during this sleep. So it's really important that you get cared for that, because that can cause fatigue and tiredness and mood changes. Hydration is really big piece. I see a lot of patients who are on 1 to 2 glasses of water a day, and then they are feeling tired, and they don't know why. I think it's because they're not hydrating enough. So it's really important that you get hydration. You can, if you find that water is boring, you can add like green tea, herbal teas, or sparkling water or things like that. But it's really important that you get hydrated, and also decreasing your sugary beverages to reduce that blood sugar fluctuation is also important. And then I think I already touched on this, but reducing the excessive use of caffeine is important, because caffeine has a physiological effect that can make you feel really anxious. Another thing, I think movement is really important. It doesn't, I think a lot of people don't like the word exercise, and that's totally fine, to just find what you really love. So if you like hiking, jogging, walking, dancing, sports, anything is totally fine. Even divided exercise in obesity, what I mean by that is, if you're just working from home and you're not able to go outside, just take a break every every hour or every 2 hours. Just take a walk for 10 minutes. Just take a walk after your lunch. However you want to move your body is totally fine. Community. I think community is really, really important. That, I think I talked about dopamine, or that feeling good hormone, is produced when you're spending time with your family and friends. It's really important that you do that more often. So family, friends, your pet can be your community, your neighbors, other support groups. So find creative, and then I think it's really hard right now with pandemic that you're not able to connect with your family and friends in person, but find creative ways to connect with your community. So family Zoom calls, organizing events virtually like this, or meeting at parks with social distance and mask. I think those are all acceptable, and try to do those more often. I think nature and mind-body connection, having some kind of connection with nature, or that, mind-body, is really important, and that I think that really helps with your overall, that whole person care. That spending time in nature, it could be connection to your potted plant at the house. If you're, living in downtown Seattle and you don't have really access to nature, then you're just potted plant at the house is enough. Any kind of meditation practice, yoga, music, dance. I think I kind of talked about that earlier, but writing, journaling can also help. Just whatever brings you joy, practice them more often. It really helps. Takeaway points. So mental health disorders are very common, but underdiagnosed and undertreated in our community, and how we can do better to change mental health beliefs in our family and community. Having that talk with our family or friends is really important. And whenever somebody expresses that they might have mental health issues, then just be open to listening to that, and having that non-judgmental attitude to that person who's experiencing that. And then you need to really be evaluated by a healthcare provider to get the diagnosis of depression, anxiety, or any other mental health condition. I highly recommend you do not use Dr. Google, which happens a lot. I see that a lot in my practice. So please do that. And please don't hesitate to ask for help. If you need help, just ask for help. My resources, I have lots of resources for you here, some counseling therapy, some of the directory for multicultural counselors. I think that can be really helpful. It also has some South Asian culturally competent providers list over there. I have suicide prevention. I think I utilize with my patients some of this. My3 app has a suicide prevention planning app that you can work on. I think it's really helpful. And if you're in crisis, then it's important that you reach out to some of these hotlines and text line. And there's other mind-body providers that I've put the list for, and I am going to provide you with this there's a PowerPoint version that I'm going to share with you with all this information here, some of the breathing exercises, meditation, and all the other things there. Okay, and then my contacts, feel free to reach out to me with any questions. I have 2 emails there. I also have a phone number that you can reach out to me, and I have my bio. I just started a professional Instagram because, so if you want to follow me there, I post some of the health related posts and tips. So if you want to follow me there, you're welcome to do that. So in my practice, I have, 2 locations currently, although I also see patients in West Yale High School, which is pretty much for all the high school students there. But I do take Regents in Primera in my Snohomish location. I'm, on the process for some other ones, but I do have income-based sliding scale if you want to see me there. And then I do in person as well telemedicine. I do have 15 minutes meet and greet session in person and phone if you want to do that, just to see if I'm a good fit for you or not. And then also Seattle location, I pretty much take all insurances, but it's strictly telemedicine and it's a teaching clinic, so you will see me through my students. Next, work topics. So what do you want to learn about? I really enjoy educating on lots of the health topics. So if you want to know more about, just email me with any of the health topics that you want to learn more about. So please do that. And this is the end of the slide. If you have any questions, please let me know. This was a really great view that I just went to a Gold Creek trail, and it was really beautiful. So I'm ready for any questions.
Yeah. Thank you, Sudekshya. So yeah, we are open for questions now. Anybody there are a few questions in the chat room already. Okay. One of the question is
give me 1 second. I'm going to open up the chat here really quick.
Sure. There are a couple of questions there.
Okay. How do I get to chat is the question.
Just under chat.
I know. Okay, let me.
I can read for you. That's fine. Okay. So the question was from Maya Didi. So she was asking, how often do you see Nepali patients in your practice out of all South Asians?
Mm-hmm. Yeah, I think I not a lot, which is also the reason that I wanted to introduce to you all that I'm there for you, and if you want to reach out to me. Currently not a lot, just because maybe I'm not sure why, but I think that's the another reason that I'm doing this, is to introduce myself to the community.
Okay, thank you. And another question is from Suprabha Shakya, and she's asking, is there a correlation between chances of depression, recovery, and age? How does the typical recovery timeline looks like?
Okay, yeah, that's a great question. So correlation of depression and recovery in age, are you, I kind of want to clarify that question a little bit. In terms of age, are you saying that in more adolescent or elderly? Is that what you're saying with the age part?
Suprabha, I think you are in the call. You can just unmute yourself and talk directly to Sudekshya.
I can answer the next question. So typically recovery time looks like, it really depends on the patient. It really varies a lot. It really, really depends on the patient. I can't really say much, but if if they do really well in antidepressants, then you can see the results within maybe a 3 months mark. But some people actually, depending on the patient, I've seen some patients do really even a slight improvement in just 2 weeks. So I wouldn't say recovery completely, but you will start to see some improvements within a few weeks, I would say. But recovery wise, it really depends on the patient.
Yeah, thank you. Sorry, I was unable to unmute. So yeah, regarding the first question, it was more for the adult people, like the old age parents back home. Just curious, like, are they more, they have more potential to get depression as compared to like young people?
Good question. I think that's a great question. And then, yes, I think I've seen some patients who are actually, immigrant grandmothers or grandfathers who are pretty lonely here. And then I think the major source of, the depressive symptoms were loneliness. And I see that a lot more here with the elderly patients. But also, I don't know the data in terms of the Nepal so much, but in terms of the US, yes, we do see lots of elderly depression a lot. And also the suicidality is much more higher in the elderly population. But also we're seeing a lot of the high number of suicidal ideation in our youth right now. So that's also increasing. So yeah.
Great, thank you. There is another question from Neil. How can people they have mental health issue? So basically, how people know that they have mental health issue?
Great question. Yeah, I think that I kind of wanted to highlight that at the entire time is that you need to really get evaluated by your healthcare provider, because it's really, you cannot diagnose yourself. You may know some of those. So I kind of talked about a lot of the signs and symptoms of some of the conditions. So you may have any of those symptoms. So you can have loss of interest in activities that you really like to do, and you're not able to do them anymore because you don't like them, or you might have a loss of appetite, insomnia, you're just sleeping too much. So it could be anything, change of appetite. I think these symptoms are part of it, but only way to get a diagnosis is from your healthcare provider, because only they know how to assess you in terms of the criteria and things like that. So I highly recommend, if you suspect that you have, or if you feel like you need to get an evaluation, I would talk to your primary care doctor, or find a doctor that you want to talk about. So I would try to get help.
Okay, I have a follow-up question on that. So if somebody diagnosed with mental health issue or depression, then it will be started with some medication right away, or there will be other thing that will get started first?
Yeah, so I think it really depends of the severity of the condition. So if there's a person who has high suicidality and a lot of risk factors, and then they're also feeling severe depression, then the first thing they probably will offer is antidepressant. But also it depends on the patient if they're willing to, if they want to. But I think we have much more room when it's mild or minimal depression, because there's less likelihood of the suicide prevention is really important. So it really depends on the severity of the patient, and then what patient want is also important. So really working with your doctor to find that treatment plan that really works for you. So, but antidepressants are part of it if it's really severe or even moderate.
Okay. And if somebody get started with the medication, then I heard something like medication, they once they started, it will be taken for longer time, or the medication can be short. Once they are recovered from depression, they can stop medication.
Right. So the taper of the medication, or what we call, is it has to be really monitored by your healthcare provider, because if you want to make sure that if they want, so it also again depends on the patient. If they want to come off of the medication, then they need to let their physician know, and then they would assess if you're stable or not. And there's a timeline that you want to make sure that they're stable for a little bit, and then you can come off of medication. However, it has to be done in a really proper way, because that's also one of the time when the suicide is really high, is when you're coming off of the antidepressants. So it should be really monitored really well and carefully done.
Sure, thank you. हजुरहरूले आफूलाई अनम्युट गरेर क्वेसनहरू राख्न सक्नुहुन्छ है। अनम्युट गर्न केही इस्यु छ भने लेट मी नो।
मैले बोलेको सुनिराख्नु भएको छ?
सुनेको छु माधव।
नमस्ते, म यसमा एउटा फलोअप क्वेसन आस्क गर्न चाहन्छु। सो स्पेशली लाइक सोसाइटी र फ्यामिलीले चाहिँ हैन कसैलाई ओपन हुनलाई चाहिँ हाम्रो सोसाइटी साउथ एसियन है पनि कुरा गर्नुभयो तपाईले हैन।
हजुर हजुर।
मोस्टली लाइक चाहिँ अब कसैले भयो अथवा भएन भनेर भन्नु अगाडि नै ओपन हुन एकदम चाहना हुन्न, कति भयो त्यसो देखेको छ हैन। त्यसको लागि चाहिँ फ्यामिली र सोसाइटीले चाहिँ कसरी हेल्प गर्न सक्छ अब त्यस्तो व्यक्तिलाई ओपन भएर? मलाई छ अथवा अब डाक्टरकोमा जान अथवा फ्यामिलीलाई भन्नको लागि चाहिँ कसरी हेल्प गर्न सकिन्छ?
तपाईँले कस्तो राम्रो कुरा निकाल्नु भयो. I think that's a big issue, right? I think we all understand कस्तो ठुलो कुरा हो अहिलेको लागि हैन. I think just awareness. I think just aware. This is one of the reason that I didn't really want to talk about mental health is like this is the we need to get more people involved or so yeah, I think awareness is one thing, and also a family member but if you're feeling that way, then I would try to find somebody that you're comfortable with, like maybe your friends or family. But then the big piece is you want to get care. So some of the resources I provided with you that you can actually depending on your insurance, some of them you can also go to just counselors and then talk about that. But I think that's a hard question for me to answer that. How would I change the belief system of people or as a society? I think that's going to take a lot of time, and then I think we just need to be be open about it. I think we just need to talk about it more often, and then also making sure that we have those conversations even in our small families or friend circle a lot more. And maybe I think that's all I can say. But just awareness is going to help.
I have a point, following up Madhav, personally say मेरो यहाँ घरमा चाहिँ daddyलाई अलिकति depression थियो. He's about I would say about 58 अनि हामी भर्खर हामी नेपालबाट आउँदाखेरि चाहिँ उहाँलाई एकदमै लाइक हुन्छ नि depression भएको थियो. And as we all know, नेपालमा यस्तो कुराहरू धेरै expose गरिदैन. It is kind of like a form of weakness to everyone. Yes, even like हामीहरू बस्दा कुरा गर्दाखेरि पनि, even for students, we don't say like, oh, मेरो बच्चाले depression भएको छ, something. We just say that he doesn't study. Like, he doesn't study. Like, ध्यान दिँदैन. Like, even like since I work in the pharmacy, so like त्यहाँबाट मलाई थाहा भयो कि like कति age को like बच्चाहरू हुन्छ, studentहरू हुन्छ, even from the younger age, they have ADHD. And I was shocked to hear like the number of medications they take. एउटा कुनै drawbacks हरू पनि छ when they are like हुन्छ नि यहाँको अमेरिकामा धेरै मान्छेहरू धेरै औषधि खान्छ, धेरै औषधि खान्छ पनि भन्नुहुन्छ हैन मान्छेहरूले. But that is a fact because they know what they are going through and they know the solution to that. But अब हाम्रो नेपालतिर हाम्रो त्यहाँतिर as I said धेरै कुराको खुलासा एक्सपोज भएको छैन. अनि कमिङ ब्याक टु माई यता ड्याड चाहिँ उहाँको त्यो होमसिक भयो, त्यत्रो एज पछि यहाँ आउनु भएर होमसिक भयो उहाँलाई. पछि हाम्रो ग्रान्ड मम पास हुनुभयो. He had a big depression but he was not ready to expose, हुन्छ नि खुलासा गर्न तयार हुन थिएन because he thought it was kind of like a form of weakness. So and then after that I don't know, because of age gap, हाम्रो बिचको एज ग्याप भएर के भएर हो, लाइक उहाँ चाहिँ कुरा गर्नु हुँदैन थियो. बट लाइक स्लोली he became open to us. Like we started to talk more and more and more. त्यो गर्दाखेरि चाहिँ एकदमै नै हेल्पफुल हुँदो रहेछ हैन. त्यो के भन्छ it's सबैभन्दा मेन पोइन्ट चाहिँ के भन्दाखेरि फ्यामिली मेम्बर्सहरू नै एकदमै सपोर्टिभ हुनु पर्दो रहेछ यस्तो कुराको लागि. किनकि त्यो हाम्रो सुदीक्षा दिदी भन्नुभएको कस्तो थुप्रै कुरा पोइन्टहरू I could relate too much. एकदमै I could relate it with my like dad or even myself भनौँ न. I'm like I call myself very extrovert हैन. मान्छेहरूले मलाई एकदमै ओपन हाँस्ने भन्छ, but like I have my own story भनौँ न behind the scene kind of thing. But those like the main thing starts from house हैन, आफ्नो घरमा. Like if you see someone even sad हुँदाखेरि पनि like उहाँले भन्नुभएको जस्तो regular stress हो कि anxiety type को हो, त्यो like हामी family memberहरूले नै थाहा पाउनु पर्छ. We need to find out by ourselves हैन. Just don't leave someone alone by themselves. We should look after each other. अनि एकदमै नै help हुन्छ. That's it's all up to us. क्या सोसाइटी भनेकै हामीबाटै सुरु हुने हो नि त.
Exactly.
अन्त so if हामीले नै गर्न सक्यो भने हुने हो त्यो कुरा चाहिँ. That was my point. And it was a great kind of like all notes तपाईले राख्नु भएको. It was like to the point kind of thing, and it was really like brief, and I really liked all those points. Thank you so much.
Thank you for coming.
हेलो हजुर म नीलबहादुर तिलिजा बोल्दैछु.
हजुर
सर्वप्रथम त थ्याङ्क यू फर द प्रेजेन्टेसन बहिनी.
हजुर हस्
अनि म चाहिँ अलि ढिलो आएँ भर्खर जोइन गरेको कामबाट 15-20 मिनट भयो
हजुर
मेरो एउटा चाहिँ जिज्ञासा नेपालमा असाध्यै धेरै चाहिँ सुइसाइडको केसहरू चाहिँ बढिरहेको छ अरे एउटा कुरा मैले सुनेको
हजुर
अनि दोस्रो कुरा चाहिँ अब यो हिजो आज चाहिँ अब स्पेसली बच्चाहरू र हामी अडल्टहरू पनि सोसल मिडियामा चाहिँ असाध्यै उस गरिरहेका छौँ हैन अब त्यसको चाहिँ कति ठुलो कन्ट्रिब्युसन हुन्छ यो चाहिँ मेन्टल हेल्थमा एउटा चाहिँ अनि अर्को यो मैले के भन्न लागिरहेको थिएँ एउटा चाहिँ सोसल मिडिया अर्को चाहिँ यो चाहिँ कोभिडको कारणले गर्दाखेरि सम्पूर्ण मान्छेहरू चाहिँ घरभित्र चाहिँ हैन थुनिएर बस्नुपर्ने अवस्था छ यसको चाहिँ कति ठुलो चाहिँ प्रभाव चाहिँ परिरहेको छ त्यो दुईटा मलाई चाहिँ जान्न मन लाग्यो
really एकदम राम्रो question. So social media चाहिँ you know I think diagnosis wise चाहिँ हामी त्यहाँ पुगेका छैनौँ कि DSM भनेको चाहिँ हाम्रो यो डायग्नोस्टिक म्यानुअल हुन्छ हैन जहाँ चाहिँ हामी क्राइटेरियाहरू डिफाइन गर्छौँ कि यो एडिक्सन हो यो नन एडिक्सन हो भनेर भन्छौँ तर I think World Health Organization actually 1 year ago came out and said के भन्छ tech addiction is real. So के भन्छ tech addiction देखि लिएर gaming, actually they started with gaming चाहिँ actually real addiction हो because we're seeing similar pattern to other addiction. So त्यो addictionsहरुबाट हामीले यो addictionलाई पनि मिलाएर भनिराछौं भन्ने कुरा गरिराथ्यौ हैन. So I think there's a big impact with social media and social and mental health, but also we are kind of in that age that we have to use a lot of the technology, but at the same time I think limiting is if you're about बच्चाहरुलाई भन्यो भने okay so कति time चाहिँ spend गर्न मन लाग्छ the social media मा भनेर उनीहरुसँग कुरा गर्ने हैन अनि they usually come up with reasonable number and त्यसपछि you want to talk about ल कति चाहिँ गर्ने हो भनेर set screen time limit गर्ने some other solutions that I have, but yeah, I think that can definitely affect the social media, and then we are seeing trend in youth a little bit the mental health social media go connection. COVID, yeah, I think that's a big one. त्यो feel भइराछ mental health एकदमै धेरै बढिराछ भन्ने छ. At the same time अब अलिकति creative ideas हरु use गरेर कसरी अब हुन्छ नि अब family सँग friends हरुसँग hang out गर्ने त्यस्तोहरु कुराहरु गर्दा हुन्छ तर it's pretty difficult. तर at the same time अब मैले अघि भने नि social distance गरेर mask गरेर के भन्छ पार्कमा भेट्ने or just zoom calls हरु गर्ने zoom मै event हरु गर्ने अनि त्यस्तो खालको event हरु गरेर त्यो connection चाहिँ still हुनु पर्यो. त्यो किनभने that's really important to हाम्रो mental community is very important हाम्रो mental health को लागि. So त्यो चाहिँ राख्नु पर्यो तर at the same time situation wise yeah it is difficult.
Thank you very much.
Yeah.
अरु कसैकै क्वेशन छ भने राख्न सक्नुहुन्छ नभएदेखि हामी अन्त्यतिर आइसकेका छौं. अब
मेरो
च्याटमा अरु पनि आएको थियो त्यसरी
मेरो एउटा क्वेशन
च्याटमा त्यति नै हो सुदीक्षा. हजुर दाइ
सुनिदैछ हैन? मैले धेरै धन्यवाद एकदमै राम्रो इन्फर्मेसन दिनुभयो हैन. अब यो अहिलेको परिवेशमा जे भइरहेको छ त्यसलाई कसरी क्युर गर्ने के गर्ने भन्ने कुरा एकदमै सटीक रूपमा धेरै इन्फर्मेसन छ. तर एउटा कुरा जस्तै अब अहिले कतिपय मान्छेहरुको यो कारणले गर्दाखेरि कतै इन्स्योरेन्स पनि बीचमा भएको छैन. भर्खर स्टुडेन्टबाट चाहिँ नि फ्री भयो इन्स्योरेन्स जागिर खाएको छैन त्यसैले इन्स्योरेन्स पनि छैन र केही चेक गराइहाल्नु पर्यो केही गरिहाल्नु पर्यो त्यस्तो प्रब्लम भयो. त्यसै सम्बन्धी भने यो के गर्नु पर्ला त्यो कहाँ जानु पर्ला कस्तो खालको होला. अर्को कुरो एउटा कुरा अहिले मैले देखेको युएसमा धेरै अब हाम्रो फ्यामिली मेम्बरहरुमा हाम्रो एज अ होल ग्रेटर सियाटलमा पनि देख्दाखेरि केटाकेटीहरु अब यो जेनेरेसन ग्याप पनि होला. अब हामीले राम्ररी बुझाउन नसकेको हामीले आफूले राम्ररी हामी आफै अनएजुकेट त्यस सम्बन्धमा चाहिँ भएको पनि होला. केटाकेटीहरु चाहिँ नि अब हाम्रो त्यो धेरै के भन्ने विचारहरु पनि मिल्दैन नि कतिपय कुराहरुमा हैन. उनीहरु अलिकति बाहिर हुने अलिकति टाढिने अनि धेरै इन्टरेक्सन नगर्ने हामीले एउटा ओके नेभर माइन्ड भन्ने हैन अनि अलिक सेपरेट बस्ने घुलमिल नगर्ने, जसले गर्दाखेरि उनीहरू झन् टाढो हुने स्थिति। अब अमेरिकामा मान्छेहरूको सबै काम गर्ने पर्यो, टाइम टेबल मिल्दैन, छोराछोरीको टाइम टेबल मिल्दैन होइन। अब यो चाहिँ जेनरल कुरा राखेको मैले देखेको। अनि यसलाई नजिक ल्याउनलाई अघि भनियो, नजिक ल्याएर उनीहरूलाई मोर सोसल बनाउने, मोर त्यो कुराहरू उनीहरूको भित्र के छ, के चलिरहेको छ होइन। अब हामीले त्यो कुरालाई कसरी निकाल्ने र उनीहरूलाई मोर सोसलाइज गराउने र त्यो अलिअलि भएको डिप्रेसन अहिले मैले सुन्दा त एभ्रिबडी आर इन द्याट काइन्ड अफ अ डिप्रेसन क्या। मैले त्यो जति पनि कुरा बहिनीको सुने त्यो कुरा सिम्टम्सहरू जुन छ त्यो कोही पनि अस्तित्व छैन कि जस्तो लाग्यो मलाई अहिले यसो हेर्दाखेरि होइन। त्यसले गर्दा त्यो कुराहरूबाट मोस्ट अब हामी त छँदैछ त उनीहरूलाई कसरी यो कुरामा सोसलाइज गराएर त्यो कुराबाट चाहिँ नि क्योर गर्न सकिन्छ। त्यो हुन आँटेको छ भने त्यसबाट चाहिँ नि कसरी भनौँ न के भन्ने त्यसलाई यस गर्न सकिन्छ होला। मेरो नाम चाहिँ दशरथ बुढाथोकी।
ए हजुर मैले स्क्रिनमा पनि देखिरहेको छु हजुर दशरथ जी। सो आई थिङ्क त्यही त एकदम राम्रो कुरा राख्नुभयो तपाईँले। त्यो इट्स रियली अब म पनि एडोलेसेन्ट्सहरूसँग काम गर्छु के भन्छ वेस्ट सियाटल हाई स्कुलमा होइन, हाई स्कुल किड्सहरू हेरेर आउँछु मैले। सो वाट आई सी इज के हुन्छ भने उनीहरूलाई पनि अलिकति कम्फर्टेबल बनाउने, तर अभियसली अब अलिकति हाम्रो यहाँ अलिक पर्टिकुलर पपुलेसन भएर होला, किनभने उनीहरूलाई पनि यहाँ अब युएसमा गइरहेछ होइन, यहाँको स्कुलमा देयर सम अब जेनेरेसन ग्याप भनौँ कि लट अफ थिङ्स आर त्यो छ इन्टरट्वाइन्ड छ होइन। एट द सेम टाइम अब ट्राई टु फाइन्ड थिङ्स टु रियली कनेक्ट विथ देम। अब उनीहरूलाई के मनपर्छ लाइक ओके हुन्छ नि त्यो कुराहरूमा अलिकति सोध्ने, अलिकति आई थिङ्क अर्को हामीले भन्यौँ नि काइन्ड अफ ओपन हुने, तर एट द सेम टाइम हुन्छ नि अब इफ देयर एकदमै धेरै स्क्रिन टाइम गरिरहेछ भने अब ओके कति चाहिँ हेर्ने हो त, लाइक लेट्स मेक अ डिल जस्तो कुरा पनि गर्ने एट द सेम टाइम। अनि अर्को चाहिँ बिगेस्ट हेल्प के हुन्छ भने एभ्री प्रिटी मच अल सबै स्कुलहरूमा चाहिँ काउन्सिलर सेन्टर हुन्छ होइन। त्यो सेन्टरमा चाहिँ उनीहरूलाई थाहा हुन्छ यो कुरा, मोस्ट अफ द स्टुडेन्ट्सहरूलाई थाहा हुन्छ होइन। त्यो पनि उनीहरूलाई त्यो त्यस्तो देखिया छ भने इफ यु सस्पेक्ट यति केही भइरहेछ भने चाहिँ आई वुड हाइली रेकमेन्ड त्यो उनीहरूसँग कुरा गर्नु पऱ्यो कि ल तिमीहरू काउन्सिलिङ सेन्टर जाने हो कि लाइक एक्चुली जस्ट गो वन्स एन्ड सी हाउ द्याट वर्क्स फर यु। अलिकति पुश त भन्दिनँ म, तर अलिकति हुन्छ नि यसो गरे हुन्छ नि भनेर भने पनि हुन्छ। सो द्याट किनभने युजली एभ्री स्कुल र कलेजेसमा काउन्सिलिङ सेन्टर हुन्छ एन्ड एभ्री त्यहाँनिर अनि केही भयो भने दे विल रेकमेन्ड अदर प्रोभाइडर्स एन्ड थिङ्स लाइक द्याट। सो also there's धेरै रिसोर्सेस टेक्स्ट लाइनहरू छ। मैले आज भने नि मेरो रिसोर्स पेज इज रियली इम्पोर्टेन्ट द्याट तपाईँलाई कुनै केही भइहाल्यो त्यो रिसोर्सहरू पनि युज गरे हुन्छ। तर अर्को चाहिँ तपाईँको प्राइमेरी केयर डक्टरलाई तपाईँको रेगुलर डक्टरलाई पनि यस्तो भइरहेछ भनेर भन्दा हुन्छ। तर अगेन एकदम गाह्रो छ तपाईँले भनेको कुरा, आई रियली अन्डरस्ट्यान्ड द्याट। तर एट द सेम टाइम कसरी उनीहरूलाई सजिलो बनाइदिने अनि at the same time resources provide गर्नेतिर म सोच्छु होला।
थ्याङ्क यू भेरी मच। तर यो मलाई एकदमै लागेको गाह्रो चाहिँ अब यो हामी आफू पनि एजुकेट हुनुपर्ने रहेछ। हामी पनि कम्प्लिटली यो सोसाइटीमा आएर अमेरिकनाइज हुन सकेको छैन। अनि हाम्रो छोराछोरी पनि नेपालीकरण भन्दा पनि अमेरिकन पनि होइन नेपालीकरण बिचको अवस्थामा छ होइन। हाम्रो यो बिचको हेरौँ अब यहीँ जन्मेकाहरू त अमेरिकनाइज हुन्छन् होला, उनीहरूले आफ्नो कुरा लिएर यो यिनीहरू चाहिँ बिचमा छन् क्या, जसले गर्दाखेरि हामीलाई पनि अप्ठ्यारो उनीहरूलाई नि अप्ठ्यारो। हामी गर्न नसकेको स्थिति छ, उनीहरू पनि चाहँदै कतिपय कुराहरू गर्न नसकेको स्थिति। यसले गर्दा मान्छेलाई बिचमा चाहिँ यो डिप्रेसनको स्थिति ल्याएको हुनसक्छ। अब बहिनीले भनेको जस्तो सिम्टमहरू आएको हुनसक्छ होइन। अनि हामीलाई चाहिँ हामीले भनेको टेरेन भन्ने होला, उनीहरूले हाम्रो कुरा प्रब्लम क्या त्यहाँ त्यो बिचमा।
त्यही त उनीहरूलाई पनि अब हुन्छ नि अब कम्प्लिटली नयाँ देशमा आएर दे आर अल्सो अलिकति कन्फ्लिक्टिङ हुन्छ उनीहरूलाई पनि। नेपालमा पनि फुल्ली छैन, यता पनि फुल्ली छैन। सो आई टोटली अन्डरस्ट्यान्ड त्यो। त्यही भएर कल्चरली कम्पिटेन्ट प्रोभाइडर्सहरूकोमा गयो भने चाहिँ यु नो दे आर एबल टु टक अबाउट यो सबै सिचुएसनहरूलाई बुझेर उनीहरूले काउन्सिलिङ गर्छ क्या। त्यही भएर इट्स रियली इम्पोर्टेन्ट अब त्यो कल्चरली कम्पिटेन्ट प्रोभाइडर फाइन्ड गर्यो भने चाहिँ यस्तो कुराहरू सल्भ हुन अलिकति सजिलो हुन्छ। उनीहरूले टिप्सहरू दिन्छ, उनीहरूले कसरी सजिलो बनाउँदै यो सिचुएसनलाई भन्ने कुराहरू हुन्छ। त्यही भएर सबभन्दा मोस्ट एन्ड इम्पोर्टेन्ट चाहिँ रियली त्यो केयर कसरी एक्सेस गराउने त भन्ने कुरा हो। अनि त्यही हो।
थ्यांक यू भेरी मच बहिनीको त्यो हामीसँग कन्ट्याक्ट पनि छ त्यस्तो पर्यो भने विल कन्ट्याक्ट यु हैन
हजुर अब हामी अन्त्यमा आइसकेका छौँ हामीले उहाँको हजुर हजुर
म निलबहादुर तिलिजा फेरि बोल्दैछु मैले चाहिँ एउटा सानो इन्फर्मेसन शेयर गर्न खोजिरहेको छु यहाँ पार्टिसिपेन्टहरूलाई
कस्तो इन्फर्मेसन होला है
स्पेसली हाम्रो यो नेपाल सियाटल हाइकिङ कम्युनिटीले आजकै अब यो मेन्टल हेल्थसँग चाहिँ रिलेटेड हाम्रो हाइकिङ एउटा कम्युनिटी छ र त्यो कम्युनिटीले चाहिँ हामीले चाहिँ एउटा हाइकर्सहरूको लागि अक्टोबरको 22 मा थर्सडे बेलुका चाहिँ 6 to 7:30 हामीले चाहिँ एउटा जुम अनलाइन एउटा हाइकिङ सेफ्टी सम्बन्धी ट्रेनिङ राखेका छौँ त्यसमा चाहिँ पार्टिसिपेट गर्नु होला र अरूलाई पनि यो समाचार खबर चाहिँ भनिदिनु होला भन्नको लागि म रिक्वेस्ट गर्न चाहन्छु
हजुर हजुर धन्यवाद धन्यवाद थ्यांक यू अब हामी अन्त्यमा आइसकेका छौँ फेरि पनि सुदक्षा डाक्टर सुदक्षाजीलाई धेरै धेरै थ्यांक यू सो मच फ्रम नेपाल सियाटल सोसाइटीको तर्फबाट एकदमै हेल्पफुल सेसन भयो आजको हामी आगामी दिनमा पनि यस्तो सेसनहरू फेरि राख्ने नै छौँ हजुरलाई उहाँलाई कुनै कम्युनिटी मेम्बरहरूको क्वेसन छ भने हामीले इन्फर्मेसन सेयर गरेका नै छौँ हजुरहरूले डाइरेक्ट रिच पनि गर्न सक्नुहुन्छ अथवा सोसाइटी मार्फत केही फर्दर इन्फर्मेसन चाहियो भने सोसाइटीलाई पनि इमेल गर्न सक्नुहुन्छ
हुन्छ अनि म मेरो त्यो एउटा पावर पोइन्ट रिसोर्स पेज भएको पावर पोइन्ट म हजुरलाई सेन्ड गर्छु अनि यु आर वेलकम टु त्यो शेयर गर्दै पनि हुन्छ
हजुर हुन्छ हामीले यो भिडियोसँगै यो पावर पोइन्ट पनि राखौँला हजुरले मलाई त्यो सेन्ड गरिदिनुहोस् अनि म भिडियो अपलोड गर्दाखेरि इमेलमा पावर पोइन्ट पनि सेन्ड गरिदिन्छु
हस् धेरै धेरै धन्यवाद सबैजनालाई थ्यांक यू
सुरज भाइ
हजुर दाइ
सुरज भाइ यो अहिले हाम्रो बहिनीसँग भएको त्यो जुन इन्टरेक्सन प्रोग्राम हो त्यो हामीले उसमा राख्छौँ है फेसबुकमा अहिले रेकर्ड
हजुर राख्छौँ दाइ हजुर हजुर यसको रेकर्डिङ छ
ए ओके ल थ्यांक यू
हजुर हजुर थ्यांक यू सबैजनालाई हैव अ गुड नाइट थ्यांक यू सुदक्षा जी थ्यांक यू सबै पार्टिसिपेन्ट्सहरुलाई
थ्यांक यू गुड नाइट
थ्यांक यू बाइ बाइ
बाइ